Lesson 16. Combining working life with caring for an ill person. Combining paid work with caring for a person with a mental illness is one of the most difficult setups you can find yourself in. Work has its own rules, deadlines, and duties that cannot be shifted, while care follows a completely different rhythm, often chaotic, emotional, and unpredictable. At some point you start to feel that these two worlds are beginning to overlap, and you are standing exactly where they meet. It is worth recognizing one simple truth: your working hours are not your private time. When you sign an employment contract, you give those hours to your employer, and that commitment has to be respected. At the same time, you cannot simply switch off your caring role with one move. It is a role that accompanies you regardless of where you are. This conflict is natural and does not mean you are doing anything wrong. It only means that you need clear rules of action so that neither of these roles starts to destroy the other. The aim of this lesson is not to idealize the situation or pretend that there is a way for both spheres to function side by side without any friction. It is about something more realistic, showing you how to build a minimum of structure that will allow you to work effectively and at the same time be a caregiver without running the risk of burnout. Psychological and professional consequences of combining roles. Combining paid work with caring for a person with a mental illness puts you into a state of overload that you often do not even notice at first. Work demands concentration, predictability, and responsibility, whereas care is the opposite: unpredictable, emotionally taxing, and you often respond to it under the influence of impulse, fear, or guilt. These two dynamics meet in one place: your nervous system. In practice, this looks like you carrying out your professional duties while part of your attention constantly stays in the ill person's world. Even if the phone is not ringing, your mind is listening out, as if an internal alarm was running in the background, a readiness for a message, a problem, a crisis. In psychiatry, this state is described as chronic hypervigilance. It does not show up as panic attacks, but as small, quiet signals: reduced concentration, irritability, difficulty finishing tasks, insomnia, muscle tension, and the feeling that you never truly rest. This state also has consequences at work. A mind that is involved in caring and working at the same time starts to operate at half capacity in each of these spheres. That is not a matter of laziness or lack of commitment. It is the effect of cognitive overload. When the brain tries to cope with two demanding roles at once, it simply starts cutting off resources, some from one, some from the other. Mistakes appear, productivity drops, and it becomes harder to keep your attention on the task. As a result, frustration grows because work begins to slip through your fingers, and caring becomes even more exhausting. It is also important to see that caring affects your functioning not just at work, but also after work. After a whole day of professional duties, you come home mentally tired, and at the same time you know you still have to look after the ill person, talk, plan medication, check how things are going. This leads to a state of chronic tension that the body tries to compensate for at the expense of sleep, recovery, and rest. Over time, symptoms of burnout appear: emotional numbness, irritability, a sense of discouragement, and even anxiety or depressive symptoms. At the same time, work is, paradoxically, one of the most important elements of balance for a caregiver. It is the only place that is not defined by the illness. It is a space where you can function normally, talk to people about everyday matters, be someone other than the one who looks after. For this reason, giving up work rarely improves the caregiver's situation, most often it makes it worse. Work provides a daily structure, a sense of competence and normality, which are essential if you are not to lose yourself in the caring role. Structuring your day and managing chaos. If you are working and at the same time caring for a person with a mental illness, you must adopt one basic assumption: during working hours you are an employee, not a caregiver. This rule does not come from coldness or selfishness, but from the fact that your working time is formally sold to your employer. During that time your concentration does not belong to you, and it certainly cannot belong to the ill person. Modern occupational medicine emphasizes that the mind cannot perform work tasks and remain in a state of caring readiness at the same time. The state of waiting for a phone call, even with one eye, triggers an alarm reaction in the nervous system, which reduces your ability to think logically and leads to chronic fatigue. That is why the most important element in structuring your day is a complete separation of work and care. This means not only switching off your private phone, but also deliberately limiting all stimuli related to the illness, not reading messages, not taking part in family discussions, not getting involved in any conflicts about the ill person during time that belongs to your employer. Your brain needs a clear signal: now I am working. Without that signal, it begins to function in a state of heightened alert, as if something bad could happen at any moment. And if every minute of work is underpinned by readiness to intervene, in practice you are working with only half of your abilities. Another element is introducing a stable schedule of contact with the ill person. You cannot be available at every hour of the day, because if you are, the ill person will begin to see your constant presence as a natural source of safety. This leads to dependence and, over time, to a situation where they call even with minor problems, treating them as issues that require an immediate response. Clear rules, for example one call in the morning and one in the evening, stabilize both sides. The ill person knows when they will be heard, and you know when you can completely switch off your caring mode and focus on work. Structuring your day also requires involving other people in the caring process. A caregiver who is working and looking after someone at the same time cannot be the only person reacting to crises or everyday problems. If you live far away, you need points of contact on the spot: a family member, neighbor, social worker, community psychiatric nurse. The idea is that during your working hours someone else can go into the ill person's home, check their condition, help in an emergency or call for help. Your role can then be to plan what happens next, but not to react immediately at the very moment you are working. Structuring the day also includes setting clear rules of communication with the family. If the ill person's relatives know that during working hours you have a complete ban on caregiving conversations, they start looking for local solutions instead of instantly bouncing the problem back to you. That is not harshness, it is a rational protection of your own mental health and a condition for effective care. In practice, this works like a filter. Problems that could have been solved on the ground suddenly start to be solved because they no longer have direct access to you at every moment. If you introduce these rules, you will notice that your work becomes calmer and care more predictable. Not because problems disappear, but because they stop intruding into the space that should not belong to them. In this form of care, a structured day is not a luxury. It is the only way to perform two responsible roles without destroying yourself. Organizational and legal support. Combining a full-time job with caring for a person with a mental illness does not rest solely on your willpower and good organization. In most countries, there are formal tools designed to support people in your situation. It is worth knowing about them, because a lack of knowledge leads many caregivers to feel they must cope alone, without any right to relief. In reality, support systems, though they differ from country to country, share a common foundation. The caregiver cannot carry the entire burden alone. The first solution you should know about is flexible forms of employment such as hybrid work, remote work, or partial home office. In many companies and institutions, the option to work from home is not just an act of goodwill from the employer. It is written into employment policies and protected by labor law. It is not about turning working from home into a way to provide care during working hours. That would be destructive for your concentration, but about giving you more control over your daily rhythm. 2 days in the office and 3 at home can significantly reduce the logistical strain linked to the ill person's day-to-day functioning. A second form of support is care leave, which exists in different variants: short-term, long-term, paid or unpaid. It is not intended only for parents of sick children. It can also be used by caregivers of adults if the situation requires it. This type of leave is not a solution to everyday problems, but it does give you breathing space in times of crisis when caring responsibilities require your physical presence. Many caregivers do not know they are entitled to it, assuming they must cope quietly without burdening their employer with their situation. Another tool it is worth using is a conversation with your manager about your circumstances. Of course, you do not have to disclose medical details or intimate family matters. It is enough to explain that you are providing ongoing care for a person with a mental illness and that sometimes this may require flexibility from your workplace. Most employers respond positively, especially if they see that you are not abusing their trust. In many countries, employers have a statutory duty to consider requests to adjust hours or place of work if this is possible without harming the interests of the company. Support can also come from social services. This includes the help of community nurses, care assistants, family workers, and programs in which social workers visit the ill person regularly to monitor their condition. The more developed the community care system is in a given country, the greater the relief for a caregiver who also has to work. In some states, there are also financial benefits for caregivers or supplements to the ill person's benefits earmarked for paying for external support. From a formal point of view, the most important thing is that you know you do not have to, and should not, fulfill the caring role using only your family's resources. Labor law and social systems in many parts of the world recognize your situation and provide specific tools of support. When the ill person exploits your absence. A caregiver who lives far away or works full-time is in a particularly difficult position. The lack of physical presence creates room for abuses that do not always stem from ill will on the part of the patient. They are often consequences of anxiety, disorganization, impulsivity, or cognitive impairment. Regardless of the cause, their effect is the same. The caregiver begins to function with a sense of compulsion, guilt, and constant pressure, and their boundaries shift in such a way that they do not even notice the moment when they stop having control over their own life. The most common form of abuse towards a remote caregiver is emotional manipulation. It can take many forms: dramatic phone calls at the least convenient moments, accusations of lack of care, or threats like "I'll do something to myself if you do not react immediately." In many cases, these are not conscious manipulations, but expressions of fear and a sense of danger that the ill person tries to regulate through your reaction. However, for you the consequences are the same as with intentional manipulation. You become that safety valve, and your immediate response determines how the ill person will cope with their tension. Over time, a relationship of dependence develops that wrecks your psychological balance and makes normal working life impossible. A second area that requires particular attention is financial pressure. Left alone, the ill person often loses control over spending or over their perception of needs. The remote caregiver cannot see the real situation, does not know what is truly necessary and what is just an emotional impulse. Requests for money become more frequent and the explanations more dramatic. The caregiver gets involved out of a sense of responsibility, but very quickly discovers that their household budget is starting to wobble, and the ill person, not out of malice, begins to treat them as a source of instant financial help, regardless of real needs. In such situations, the most important rule is what community psychiatry calls control of economic stimuli. This means that the caregiver should not provide money in an unlimited, impulsive, or immediate way. Instead, clear arrangements are needed: a fixed amount for food, a fixed amount for medication, paid-up bills, possibly phone top-ups, but nothing beyond that without prior verification. The more you structure the financial side, the less room there is for abuse and the greater the sense of stability on both sides. People with mental illness function better in predictable structures than in unlimited financial freedom, which often leads to chaos. Another mechanism of abuse is managing your guilt. The ill person may send you emotional messages like, "If you lived here, I wouldn't have this problem. You don't care about me. If you really loved me, you'd help me now." Although these words do not have to come from bad intentions, their function is always the same: to force you into an immediate response. This is a typical pattern of behavior in people with psychotic disorders, mood disorders, or anxiety disorders. These mechanisms are well known and described in clinical psychology, which is why your response should not be submission but the clear maintenance of boundaries and repeated messages such as, "I'll deal with this when I can, we'll talk about it this evening, this is not the time for such conversations." The most important thing is for you to know that setting boundaries is not a lack of love. It is an act of responsibility. What the ill person needs from you is not so much an instant reaction as stability, predictability, and consistent rules. If that stability is missing, they begin to act through emotions, and then your working and private life becomes a hostage to their fears. Protecting your own boundaries is not selfish. It is one of the most important elements of care, as necessary as medication, consultations, and healthy communication. Long-term balancing of work and caregiving. Combining care for a person with a mental illness with full-time work requires not only day-to-day organization, but also a long-term plan that will safeguard your future. Without such a perspective, a caregiver very quickly starts living from crisis to crisis, in growing tension, convinced that any change in rhythm will disrupt a fragile balance. In practice, this leads to the gradual shrinking of your life, your work, your family, your health, and even your sense of identity. First of all, you need to be aware that care, no matter how necessary it is, cannot become the main axis of your life. If you subordinate all other areas to it, sooner or later you will burn out. A person who does not rest, does not develop professionally, does not nurture relationships, and does not take care of themselves begins to react with excessive irritability, indifference, or withdrawal. These are not signs of a lack of love, they are natural reactions of a body that lives in a state of chronic tension. That is why long-term planning must include not only the ill person, but also you, your health, your career path, your family, and your future. A second element of balance is systematizing the burden of care. If you live far away or work full-time, you cannot be the command center for the entire family. You have to work towards a division of responsibilities, no matter how reluctant other relatives may be. If you take everything on yourself, you will do it at the cost of your job, your marriage, your health, and your social life. Over a period of a few years, this strategy always ends in crisis. That is why, in the longer term, it is essential to delegate tasks, organize local support, and use all available system tools so that institutions also take part of the responsibility off your shoulders. The next step is to make sure that care does not deprive you of professional development. If you limit your ambitions and block your chances of promotion just because the ill person needs care, frustration will eventually appear, first mild, then growing. Over time, this frustration turns into resentment towards the ill person, towards yourself, and even towards your whole life situation. This is precisely why specialists emphasize that a caregiver must have the possibility of professional growth. It is not about egoism, but about preserving psychological balance. If your career is put on hold, your whole identity will shrink to a single role, the role of caregiver, and at some point you will stop recognizing yourself. In the long run, it is just as important to care for your own family and social relationships. Loved ones often patiently wait for the time when care for the ill person will stop being so demanding, but that moment does not always come. If you neglect your relationships, you will reach a point where you are left completely alone with the caring role. That is why you must look after your own bonds, nurture and protect them, even if it means limiting contact with the ill person to reasonable hours and clearly defined days. Healthy relationships are your safety net. Without them, you are like a caregiver standing on the edge of a cliff without a harness. The last element of long-term balance is the awareness that your care cannot be the ill person's only strategy for the future. You have to think about what will happen when you are no longer there, about supported housing, support centers, day programs, community assistance. A caregiver who tries to single-handedly carry and care for a dozen or so years eventually can no longer bear the weight, and when they drop out of the role, the ill person is suddenly left with nothing. That is why, alongside your care, you must build a plan in which it is the system, not you, that takes over a greater part of the responsibility. Long-term balancing of work and care rests on three pillars: protecting yourself, protecting your future, and organizing a support system that will not collapse when you take a deeper breath. Without this, care will start to pull you in like a whirlpool. With it, you have a chance to carry it out not only effectively, but also with dignity and without losing your own life. Summary: combining paid work with caring for a person with a mental illness is one of the most demanding situations you can find yourself in. This lesson has aimed to show you that effective care is not about being available always and everywhere, but about building clear boundaries, structures, and long-term rules of action. Work is not only a source of income, but also a space where your mind can rest from the chaos of care. For that space to function, it must be protected both from phone calls and from emotional pressure from others. Your role as a caregiver is not to put out every fire immediately. It is to create a system in which you are not the only person responsible for the ill person's safety. Delegating tasks, involving the family, using institutional support, and building a daily structure are not signs of selfishness, but of maturity. Without them, care turns into a spiral of overload that sooner or later ends in burnout, and a burnt-out caregiver is not able to help anyone. The most important thing you should take away from this lesson is the awareness that your mental health and your work are just as important as the ill person's well-being. When you take care of yourself, you also take care of them. When you protect your working time, you protect your stability. When you maintain boundaries, you create predictability, and that is what the ill person needs most.